Cervical cancer used to be a leading cause of cancer death in women. But today, it's one of the most preventable and treatable cancers we have if we catch it early. I'm Dr. Anim, and today on Health Made Simple, we're talking all about cervical cancer. What causes it? Who's at risk? And most importantly, how we can stop it. Let's break it down. Cervical cancer starts in the cervix, which is the lower part of the uterus that connects to the vagina. What makes it unique is that we know exactly what causes it. About 99% of all cervical cancers are caused by a common virus called human papillomavirus, or HPV. Globally, it's the fourth most common cancer in women. But here's the hopeful part. In countries with good screening programs and HPV vaccination, rates have dropped dramatically. The tragedy is that most deaths happen in places without access to these tools. This is a disease we know how to prevent. So let's start with the root cause. HPV. It's actually a group of over 200 viruses, and it's spread through skin-to-skin sexual contact. Here is a fact that might surprise you. About 80% of sexually active people will get HPV at some point. Most people get it shortly after becoming sexually active. But the good news is, in about 90% of cases, your immune system clears the virus on its own within 2 years. You might never even know you had it. The problem is the other 10%. When a high-risk type of HPV, like HPV 16 or 18, doesn't go away, it can cause changes in the cells of the cervix. Over a long period, usually 10 to 20 years, these changes can turn into cancer. This long timeline gives us a huge window of opportunity to find and treat these precancerous changes before they become dangerous. So who's at risk? Besides having a persistent high-risk HPV infection, a few other things can increase your chances. Starting sexual activity at a young age, having many sexual partners, or having a partner who has had many partners all increase your exposure to HPV. Smoking is another big one. It weakens your immune system and makes it harder to clear the virus. Smokers are about twice as likely to develop cervical cancer. A weakened immune system from things like HIV or certain medications also raises the risk. Now here's the really challenging part. Early cervical cancer and precancerous changes usually have no symptoms at all. This is exactly why screening is so critical. When symptoms do appear, the most common one is abnormal vaginal bleeding, like bleeding between periods, after sex, or after menopause. Other symptoms can include unusual discharge or pain during sex. If you experience any of these, please see your doctor. Don't panic, as these can be caused by many other things, but it's always best to get checked. So how do we screen for it? There are two main tests, the Pap test, which looks for abnormal cells on the cervix, and the HPV test, which looks for the virus itself. Guidelines vary by age, but generally, women between 21 and 65 should be screened regularly. For women 21 to 29, it's a Pap test every 3 years. For women 30 to 65, you have options. A Pap test every 3 years, an HPV test every 5 years, or both every 5 years. If your screening finds something abnormal, the next step is usually a closer look at the cervix and maybe a small tissue sample or biopsy. If precancerous cells are found, they can be removed with simple and highly effective procedures, stopping cancer before it even starts. If cancer is diagnosed, treatment depends on the stage. For early stage cancer, surgery is often the main treatment, and sometimes fertility can be preserved. For more advanced cancer, treatment usually involves a combination of radiation and chemotherapy. The great news is that when caught early, the 5-year survival rate for cervical cancer is over 90%. This is why screening is so important. It finds the cancer when it's most treatable. But let's talk about the most important part, prevention. Cervical cancer is one of the most preventable cancers, and the HPV vaccine is a true game changer. The vaccine is recommended for boys and girls around age 11 or 12 before they're exposed to HPV. It's safe and incredibly effective, preventing up to 90% of cervical cancers. In countries with high vaccination rates like Australia, they are on track to virtually eliminate cervical cancer. Even if you're vaccinated, you still need regular screening because the vaccine doesn't cover every single type of HPV. So, here's the bottom line. Cervical cancer is caused by HPV. We can prevent it with the HPV vaccine, and we can catch it early with regular screening. This is a cancer we have the tools to defeat. If you're a parent, get your kids vaccinated. If you're due for a screening, please schedule it. I'm Dr. Anim, and this has been Health Made Simple. If you found this helpful, please like, subscribe, and share this video. Protect yourself, stay informed, and I'll see you in the next one.